Dear colleagues, we are pleased to introduce the rehabilitation concept that includes neuromuscular functional assessment and treatment called Dynamic Neuromuscular Stabilization. Dynamic Neuromuscular Stabilization, in short, DNS, is a unique rehabilitation strategy based on the principles of developmental kinesiology and the neurophysiological and biomechanical aspects of the maturing postural locomotor system. DNS defines posture, breathing patterns, movement, and joint function from a neurodevelopmental perspective. Normal early progress during the first year of life leads to the development of an optimal postural locomotion function. DNS assessment is based upon the comparison between the patient's stabilizing motor pattern and that of a healthy infant. The treatment approach is based on ontogenetic postural locomotor patterns. Optimizing the distribution of internal forces of muscles that act on each segment of the spine and or any other joints is the primary goal of this treatment approach. One of the most important neurophysiological principles DNS applies is the relationship between the CNS control mechanism, muscle function, and the anatomical parameters of the skeleton. The correct central program, that is, the physiological development, enables balanced muscular coordination, which ensures an optimal movement strategy resulting in optimal formative influences on skeletal structures and thus ideal morphology. Here is an example. What are the differences in shape between the newborn and adult femur? The newborn has a femoral neck shaft angle of 150 degrees, whereas the norm for an adult is 125 degrees. During human development, the muscles are used differently in specific developmental positions, forming the maturing bone as it grows. If the brain develops physiologically, optimal muscle coordination occurs and the child presents with physiological movement patterns, ensuring optimal skeletal function. Generally, we can say the function forms the structure and the structure then serves the function. Under pathological conditions, we can observe not only abnormal postural locomotion function. You can see that the patient is not able to stand or walk independently and requires support from the use of crutches. Furthermore, bone and joint deformities occur as well. Generally stated, dysfunction deforms the structure. This rule is very evident in infants when the skeleton develops rapidly, but we can also observe such close relationships between structure and function in the adult population. Suboptimal postural development is imprinted into the morphology of the adult skeleton and muscular system. Here, you can see hypertonic paraspinal musculature related to lower rib cage flaring or abnormal position of shoulder blades. Dysfunctions can be presented in static, but even more in a dynamic situation, meaning during movement. Generally, we can describe three basic types of global postural movement patterns that occur during child development, in everyday life activities, and also during sports. First, we present an undifferentiated symmetrical movement pattern where both upper or lower extremities work symmetrically either in an open or in a closed kinematic chain. In the upper pictures, we can see that both the infant and the adult activate all four extremities in phasic function, which means in an open kinematic chain. Squatting, as can be seen in the bottom pictures, represents the situation when both lower extremities work in closed kinematic chains, serving for support, while both upper extremities are phasic, working in open kinematic chains. Secondly, we present the ipsilateral pattern, which occurs when the same side extremities work in a closed kinematic chain, serving for support. Meanwhile, extremities on the other side of the body are phasic, working in open kinematic chains. We use the ipsilateral pattern whenever our body rotates. And finally, we use contralateral patterns whenever we want to move our body forward. For example, when we creep, run, walk, or climb. In this pattern, the opposite side extremities, for example, right upper and left lower limb, both work in an open kinematic chain, stepping forward. Meanwhile, the left upper and the right lower limbs work in a closed kinematic chain, securing body support. The IPSI and contralateral pattern develop simultaneously during the first year of human life. All three global motor patterns, undifferentiated symmetrical, differentiated ipsilateral, and contralateral patterns, are each fully dependent on trunk stabilization. Trunk stabilization is a prerequisite for all movements. Developmentally, trunk or core stabilization is completed at the age of 3 months. The cervical and upper thoracic spine is stabilized via well-balanced coordination between deep neck flexors and cervical spine extensors. Diaphragm, pelvic floor, and abdominal wall musculature regulate intra-abdominal pressure, which stabilizes the lower thoracic spine and lumbar spine from the front. Paraspinal musculature stabilizes the low back from behind. Perfect stabilization synergy keeps the chest and pelvis in a parallel position, allowing for spinal elongation. Trunk stabilizers must be active before the phasic movement starts. It is a feed-forward mechanism which occurs automatically. This animation demonstrates how the core needs to stabilize and maintain the neutral spine during hip movement. When trunk stabilization fails, we can observe rib cage and pelvic instability, especially during movements resulting in lumbar and cervical spine compression and overload. Permanent suboptimal stabilization may result in repetitive strain injuries of joints, ligaments, and intervertebral discs. In assessment, we always compare the norm defined by physiologically developing children with the quality of postural stabilization presented by the client. For example, this child presents with a perfect spinal elongation, while in the adult we can observe cervical spine collapse from a rigid thoracic kyphosis. The supine child demonstrates perfect neutral position of the trunk, while the patient's flaring of the rib cage can be seen. In DNS, any developmental position can be used in treatment, training, and self-treatment. At first, the clinician manually assists to achieve ideal stabilization. Later, the patient continues with self-treatment, making the exercise more challenging by adding the movements, load, resistance, and any other kind of stimulation. Dynamic neuromuscular stabilization serves numerous purposes. It is a functional diagnostic concept. DNS assessment is based upon the comparison of the patient's stabilizing pattern to that of a healthy infant. Developmental kinesiology helps us to explain and understand the etiology of various musculoskeletal disorders. The treatment goal is to achieve functional joint centration, global muscle coordination, and optimal trunk stabilization, ideal respiratory patterns, and good quality of motor function. Because DNS is based on neurophysiological principles, we can apply the concept in the assessment and treatment of various patients or clients, such as developmental problems in infants, poor posture and scoliosis in kids, to prevent and treat repetitive strain injuries in the athletic population, to treat common musculoskeletal disorders, neurological and orthopedic patients, and senior clients as well. In women, an important topic is pelvic floor dysfunction, pregnancy, or problems after labor and delivery. What exactly can we do for our clients? Let us introduce the most important topics we cover in DNS courses. It is critically important to recognize any suboptimal development in infants, especially during the first year of life. In pathological cases, it is necessary to start with treatment as soon as possible, before any abnormal movement patterns have become established. Therefore, in DNS pediatric courses, we teach course attendees how to distinguish normal and abnormal development during the first year of life. Applying DNS principles in infants during the first year of life, we can stimulate the achievement of important developmental milestones at appropriate times. We can stimulate symmetrical development. We can improve the quality of movement. We can educate the parents how to properly handle infants and what appropriate tools to use. When applying baby handling therapeutically, we stimulate the child to reach the position that is typical for the infant's developmental age in those instances when the child cannot adopt it spontaneously. The proprioceptive information resulting from proper positioning and approximation stimulates the infant's brain and allows it to learn and establish the position. The ultimate goal is to make the child integrate the newly learned position as spontaneous motor behavior. Our educational system, called DNS Fit Kid, is a program for younger school-aged children 6 to 10 years of age who suffer from poor posture, need to improve core stability, and or to be better in sports. The program consists of exercises based on 5 developmental positions. It serves as a home exercise program for children aimed at both the treatment and prevention of musculoskeletal pain. These exercises can also be used as a fundamental dynamic warm-up for not only common recreational play, but also youth athletic training. The DNS Exercise app and DNS Exercise Journal explains the developmental exercise positions to children in a fun, relatable manner, comparing them with the way animals characteristically move and pose. The concise text and colorful illustrations help to explain not only how the child ought to move, but also what they should feel during exercise movement or position. Details about how to detect and correct the common errors and movement faults typically seen with each exercise are included. To incorporate speech development while also helping train exercise transitions, movement therapy, mimicry, and team exercise, the DNS has included a variety of rhythmic songs to be sung by the user with every global movement routine. Why to apply DNS in sport? Optimal posture is a prerequisite for top athletic achievements and safe sports performance. Every sport has different training methodology, strategies, and tools. However, trunk stabilization is a cornerstone for every motion. Please compare the two exercising individuals. The lady performs with a poor quality of intra-abdominal pressure stabilizing mechanism while lifting her legs. As a result, she increases spinal lordosis and overloads the lumbar spine. On the contrary, the exercising gentleman demonstrates an example of excellent trunk stabilization and optimal intra-abdominal pressure control even when lifting the legs while exercising with the load in his hands. His back adheres to the floor due to increased intra-abdominal pressure, which stabilizes the spine ventrally, preventing hyperlordosis and lumbar overloading. Demonstrating command and control over each sport position and the transitions from each position is the goal of the entire movement. In sport training, DNS emphasizes functional joint centration, quality of movement, full body awareness, appropriate breathing stereotypes, sufficient stabilization for speed, endurance, strength, and increased quality of movement. DNS can also be applied in neurological patients with various central and peripheral nervous system disorders. It is important to analyze neurological symptoms in detail and set up optimal treatment strategies based on clinical neurological assessment. CNS disorders are analogous to ontogenesis reversed. That is to say, the greater the brain lesion, the more the patient's posture resembles that of the neonate. But sensory and motor cortex organization can be changed with appropriate exercise. The DNS goal is to restart that organization and rehabilitate postural locomotion function toward higher developmental positions and better movement. Neurological patients frequently lose their independence and the ability to perform activities of daily living, thus suffering from reduced quality of life. CNS treatment goals are to address the clinical symptoms that can be influenced by postural training and sensory motor integration. The ultimate goal is to achieve the highest level of motor function, verticalization, and locomotion, allowing for maximum independence. Depending on the level of disability and available postural locomotor function, the condition of patients with neurological deficits can be compared to the developmental stages. The DNS therapeutic goal is to achieve the highest possible developmental stage, which means the highest possible degree of locomotion, even with reduced posture and movement quality. Neurological patients with different types of diagnoses may present with similar problems. For example, shoulder dysfunction may occur after stroke, peripheral nerve injury, in a patient with muscular dystrophy, or after spinal cord injury. In all of them, we aim to evoke maximum compensatory capacities allowed by present morphological limits and neurological deficits in order to achieve the best function. Here is an example of how we work with a patient with a C7-T1 spinal cord lesion. We train trunk stability in a developmental position called low oblique sit, which corresponds with the developmental age of 7 months. Trunk stability is critical for safely sitting in a wheelchair, transferring from the wheelchair to a bed or bath, as well as for breathing and for communication. Here you see DNS training in a stroke patient suffering from right-sided paralysis. Typical symptoms following strokes involve disturbed gait, disturbed balance, and sensory motor deficits on the paretic side of the body. The first goal is to stimulate sagittal core stabilization and appropriate breathing stereotypes. For such purposes, the 3-month developmental position can be used. Exercising in the low oblique sit, again corresponding with 7 months developmentally, the therapist controls trunk stabilization and supporting function on the paretic side in order to achieve optimal body awareness and postural locomotion function. Pain and range of motion must be simultaneously respected and controlled. The modern population is aging. On a daily basis, seniors must deal with various signs of functional and structural involution, such as decreased maximum aerobic capacity, general fatigue, sarcopenic muscular weakness, reduced sensory processing due to limited sight, hearing, and balance, and many other disturbances. Some symptoms may be positively influenced by DNS training. Endurance and difficulty of the modifications must be adjusted to meet the individual client's capacities. When exercising, the movement needs to be slow. The client must be fully aware of appropriate weight bearing of support segments and phasic movement performance. The goal is to maintain or increase range of motion and to maintain muscle strength. The exercise also has a positive effect on cardiovascular conditioning and cognitive function. We must always respect the individual limits of a particular client. When working with the aging population, it is essential to integrate stretching, self-mobilization, core stabilization, strengthening, endurance, and sensory stimulation within each series of exercises. DNS strategies can serve all of these purposes. All the programs should be integrated into daily life activities. DNS assessment and treatment follows the same principles, regardless of what kind of patient we work with. This is because DNS is not a technique. Again, it is a general neurophysiological principle. For more information, please visit the DNS website and subscribe to the DNS online library. Thank you for your attention.